Hi, my name is Walter Miranda Sanchez. My topic is Fairview Cancer Rehab Program Outcomes and Effectiveness. Definition: Cancer rehabilitation program consists of a variety of interventions. It is important for persons to participate in physical therapy due to the risk of continued muscle atrophy and the conditioning that may occur with inactivity, as well as due to the numerous impairments that can result from treatment.
Dr. Khalil, on my last visit, after everything was fine, said, well, now we have another step. How would you like to go and try a program? It's kind of experimental. It's just starting up at Health and Wellness.
As a hematologist, oncologist, I see patients every day, 5 days a week, different variety, different walks of life, with multiple diagnoses of cancer. Cancer-related symptoms, including fatigue, weakness, tiredness, lack of energy, sleep problem, and pain, are common symptoms. Medication can do only so much. Because of that, we want to step out of the box and follow the American Cancer Society recommendation, and we explore the option of a specific exercise program designed for cancer survivors.
It goes back to when I became a cancer exercise specialist about 12 years ago, and I started a similar program where I lived before. And so here my ambition or my desire was to duplicate that so we could impact patients locally.
To begin with, I was kind of a grumpy, frumpy old man, and he just kind of made me go through the routine. In the end, we became friends, and then we'd have a dialogue, and he and a couple of the other trainers, we actually, as you saw today, we actually became kind of a little family, because we all have different cancers, but we all have the same problems, and that's recovery.
We're going to provide an initial consultation, so we already know their cancer history, but we're also going to look at other health concerns. It might be cardiology, it might be neurological, and then perhaps get their other physicians' approval too, so we make sure there's no limitations. From there, we do a fitness assessment, and then we'll do an equipment orientation, and then once we're through that, then they start training twice a week in small group training sessions with strength training and cardio, and stretching as needed, functional balance training, and that's what they can expect.
At the time when I was done with the radiation, I was weak, and what this did is, I'm not sure I'm 100% yet, but I'm probably 95% back to what I was, and maybe even a little bit more than what I was before I went in. I'm certainly much healthier.
The program is changing lives and having a positive impact on patient outcomes.
By diagnosing cancer and providing state-of-the-art treatment, and also assessing our patients' need, if it is providing with access to exercise program, we are trying to do our best to meet our mission by provide a Christ-like healing.
Applications in physical therapy. Physical therapy should include interventions that specifically address each individual's impairments resulting from the cancer and cancer treatment. This may include a progressive strengthening program to increase lean muscle mass, aerobic exercise for conditioning, along with some balance and coordination exercise.
Symptoms that are caused by cancer and by their treatments are best addressed through rehabilitation. And this is not just physical therapy or exercise. This focuses on kind of a comprehensive evaluation of where someone starts before the treatment, during the treatment, and then after the treatment. Our goal is to get someone back to where they were before the treatment. And that involves evaluating what's important to them and improving their quality of life on a day-to-day basis. Frequently, this is through the use of physical therapy and exercise programs to combat fatigue, but also this is through increasing range of motion, increasing any problems they may have had through surgery, and these are best accomplished through the use of physical therapists, occupational therapists, and even speech therapists, which we have in our new cancer rehabilitation line.
Patients that have the diagnosis of cancer are just like any of our other patients we treat, whether it be for an orthopedic injury, a neurological deficit, they're just like anyone else.
I don't know that we have an exact answer of how rehabilitation helps the patient beyond the expected results of good cardiovascular fitness, good muscular strength, better mobility. It's a very general help, but what's gratifying to me is that the research is showing that the outcomes are better. So clearly it contributes to the recovery of the patient. It makes sense because the ravages of the treatment, chemotherapy, radiation, can completely bring all systems down. And so rehabilitation is sort of a general effort at bringing all systems back up.
Pros and cons. Pros. Fairview's cancer rehabilitation program had a positive impact on the patient's quality of life, as well as their physical and mental functioning. The result of this program demonstrates improvement in quality of life issues such as fatigue, mental health, physical activities, pain, and endurance. Cons. Cancer-related impairments impact many facets of an individual's life. Currently, there is limited knowledge on effectiveness of individualized cancer rehabilitation programs.
On the health beat, typically when you think of physical therapy, you think about recovery after surgery or an injury. But PT can do much more than that. We've got physical therapist Christy Wilson joining us in studio today. Christy's with the Hendricks Regional Health. It's great to have you here.
Thank you so much.
So we're talking about physical therapy helping with a number of things, including people who are battling cancer, right?
Correct. At Hendricks Regional Health, we do something very unique in that we screen every cancer patient who is currently having radiation as well. So we not only are, we call them touch points, we are trying to touch that patient at different points during their cancer journey. So we not only see them during radiation, but also during chemo or any other time that a surgeon or oncologist may feel that they need physical therapy for. Even energy conservation, helping them with an assisted device, if any swelling issues, bowel or bladder issues, educating them on returning to sexual function and so forth. So we, in physical therapy, there's a new thing called oncology rehab. More and more cancer survivors are living longer, so helping them through their journey through cancer survivorship.
And what are these cancer patients telling you after they've gone through physical therapy? What are they saying it does for them?
Well, and it totally depends on the type of cancer, but there's a surgical component helping people from post-op, but then also there is a component after chemo. So chemo has many different side effects, and we can help them with balance issues, we can help them with some of the neuropathy pain issues that are occurring, but then also the fatigue and getting them back strength-wise. We also have a Live Strong program through our Hendricks YMCA that they are allowed to come and have a personal trainer and work out as a group at our YMCA.
When should someone get help from physical therapy?
So from an oncology perspective, even heading that person off as soon as they are diagnosed is a time that they are considered a survivor. So helping them start that journey, and then also in the midst of the journey, anyone having any issues, honestly, so it can be from having a tenderness in an area, anything that's impeding them from performing the activities of daily living that they want to perform throughout their lifespan.
And we've got that listed on the screen there: aching, pains, tenderness, swelling, limited range of motion, weakness, and numbness, all things that they can really benefit from a physical therapist.
Correct.
Yeah, it's great to have you here, Christy. Thanks so much.
Issue applied in Ecuador. In Ecuador, an oncology patient may have different forms and techniques for the rehabilitation that are defined according to the need and specific of each case. That is why the experience of the specialist and his team is essential to achieve the best results. Physical rehabilitation is a fundamental service in a management of pain and other side effects of disease and treatments. It is a support to the patient that integrates with other medical specialists that participate for the improvement and recovery. Physical rehabilitation is carried out by a team formed is a physiotherapist and physiotherapist with extensive experience in the recovery of cancer patients and the wide variety of therapeutic techniques. Conclusion: cancer patients and survivors live with a number of side effects that affect their quality of life and functional abilities. Result of the effectiveness or favors cancer rehabilitation program in improving that participants' fatigue level, quality of life, activity tolerance, grip strength, pain, and balance with physical therapy are positive. The results suggest that these patients maintain improvements in their quality of life and pain levels with participation in exercise in a community setting even after completed therapy. Thank you.